Area's local news station.
Happening right now, Santa Clara County's public health director is addressing questions about the criteria to lift indoor mask mandates. So let's listen in live.
Robust vaccination in the population. Essentially, we want to ensure that we have many layers of prevention. We want to make sure that the vaccination layer is really robust before we peel back the masking layer. So I'll explain these metrics a bit more. So whenever possible, we want to, our aim was to adopt a metric that would be easy for the public to follow along. And so for the community transmission metric, we're looking at the CDC's metrics on their data tracker that are posted on their website. So we need to see that our county is in yellow for 3 continuous weeks. Right now we're in orange, but we're trending down, and so we may reach yellow soon. For vaccinations, we will be updating our public dashboard to show the percent of total vaccinations, total population vaccinated, because the vaccination metric is we either need to reach 80% of the total population vaccinated or 8 weeks since the 5 to 11-year-old age group is eligible to be vaccinated. So it's an or, whichever one we reach first. The 80% you'll be able to track on our dashboard, and the 8 weeks, of course, everyone will know once the announcement is made that it's 8 weeks after that. And finally, the hospitalization metric, that one is in the judgment of the local health officer. So hospitalizations need to be low and stable in the judgment of the local health officer. That's not one that you're going to be able to track on our public dashboard. And we really spent a long time discussing this metric. It has a lot to do with the hospital capacity in the jurisdiction. I can tell you that at Santa Clara County, our hospital capacity is on the robust side, so that metric is going to be fairly simple for us to meet. Before I take questions, I first want to express my enormous gratitude to the public here in Santa Clara County and across the Bay Area region. We, as a region, our public has by and large embraced the COVID prevention measures that we've talked about and asked everyone to do. And because of that, our rates are fairly low. We have had a 4th surge, but it has been relatively blunted compared to the experience in other parts of the state and country. So we have our prevention strategies that we know. We know vaccination, masking, ventilation, distancing, and testing is needed. These are the strategies that protect us. These are the strategies that our public has embraced. And together, I hope that we can get to the other side of this pandemic as quickly as possible. And I'm happy to answer any questions.
We'll call on everyone individually. We will start with the Mercury News.
Looking at the trends, when do you think that we can get rid of the mask mandate indoors? What kind of timeline do you see in this county and perhaps others?
Well, I think it's going to be hard to say. So we have to meet all 3 metrics. It's an and. Low and stable community transmission and hospitalizations low and stable and robust vaccination by one of these 2 measures. I would say that we're pretty much there with the hospitalization metric. So what we need to do is watch our community transmission and our vaccination.
So when do you think, like a rough idea? A week, a month?
Well, I think that the metric that's probably most important and is going to be the most challenging is the vaccination metric, because we need 80% of our whole population needs to be fully vaccinated, or 8 weeks since the 5 to 11s become approved for use by the FDA and the other bodies.
We'll go to KPIX.
San Francisco is announcing on October 15th that they're allowing mask mandate to be lifted in certain settings, offices, gyms, religious gatherings, college classes. If they can prove that everybody there is vaccinated, there's a long list of rules. Do you anticipate Santa Clara County having something like that that gives private organizations some kind of flexibility in that regard?
As you know, in Santa Clara County, we do not have any vaccination mandates. So unlike some other jurisdictions, we don't have a vaccination requirement or a mandate for restaurants or bars or gyms or what have you. We have always here sought to have rules that are as simple as possible, as easy as possible for the public to understand. And so here in Santa Clara County, as well as most jurisdictions in the Bay Area, we will keep our requirement for indoor masking, regardless of vaccination status, until we meet these metrics that we've adopted across the Bay Area.
NBC?
So in your discussions with your colleagues, is there debate or discussion going on in terms of everybody maybe implementing everything at the same time, so you don't have one neighboring county with different requirements or different standards or restrictions than another county that could be literally a few feet away?
Yeah, thank you for the question. What we decided, and this was a lot of discussion amongst our group, and as you know, the Bay Area health officers, we've been working together quite closely since the beginning of the pandemic. So what we landed on was shared metrics, but it may be that one county reaches the metric before another adjacent county. So we will probably be lifting the indoor masking requirement at different times, simply because the hospitalization and community transmission rates differ by county, as well as the vaccination rates.
So are you concerned, though, that could cause a problem in terms of one county lifting it, the neighboring county doesn't?
I think what's important is that we communicate to you all and to the public how we are thinking about this and what factors are important. And so that there are shared metrics across the region, and that those metrics are something that the public can see. The public can see what percent of the population is fully vaccinated. The public can track on their calendar how many weeks has it been since the vaccine was approved for use in 5 to 11-year-olds. The public can look at the CDC website and look at Santa Clara County and see how long has Santa Clara County been in yellow. So the most important thing is that we have metrics that are relatively simple and that the public can see and that we can track them together.
NTD?
So, my question is, once the county decides to lift its mask mandate, will this be permanent, or will masks be lifted if the county stays in the state?
We do not have a shared metric across the region regarding reimposing an indoor masking requirement. But what I can say is that some of the things that we will all be looking out for are emergence of a new variant, how the vaccines do over time with any new variant emerging, and things like that.
Spotlight?
Yeah, as you know, there have been inequities in vaccinations and rates in communities of color and low-income communities. So I'm wondering if the state or the county's health equity metric was considered in drafting these metrics for lifting the mandate.
Yes, there are so many different factors to consider, and so many different factors to weigh together to come up with this metric. All of us across the Bay Area are laser focused on ensuring that everyone who needs a vaccination gets a vaccination. And we've adopted many strategies across the region I think most counties have the equivalent of our MOVAX, which is specifically tailored to reach vulnerable communities and try to encourage vaccination in those communities.
Mercury News.
Yeah, just to be clear, if you need the total population of 80% vaccination, that includes infants, whatever, right?
That's right.
Okay, and where are we now?
Right now, we have, if I've got it right, 72.4% of the total population in Santa Clara County is fully vaccinated.
KTSF.
What percentage of the population is 0 to 11? Because that seems like a number that may not be able to be reached, so you have to go directly to the 8-week mandate.
I don't have that number offhand, but what I can tell you is there are just shy of 175,000 5 to 11-year-olds. So that's the size of the population that we anticipate will become newly eligible for vaccination. And that's the population that we're going to be working very hard to ensure that there's easy, accessible vaccinations available to 5 to 11-year-olds when they become available.
KPIX.
Do you think we'll have holiday parties with no masks this year?
I think it's important to remember those 5 important prevention strategies to prevent COVID: vaccination, masking, testing, ventilation, and social distancing. We also know that the pattern we've seen by and large with COVID is about a 2 months on, 2 months off, 2 months on, 2 months off. So last year we saw our cases begin to tick up in early November. Whether we'll see that this year, I don't know. But regardless of when holidays are scheduled, what's important is to see how much COVID is circulating and how many of those layers of prevention do I need to make sure are in place to protect myself and my family. That's really the key.
Sounds like a maybe.
NBC. Any follow-ups? Anyone else over here? Thank you everyone for attending. We appreciate you being here. We will now begin with the Spanish portion of our media event, followed by other languages. And we're available on the PR side if you need us later. Thank you.
We were just listening in on a press conference with Santa Clara County Health Officer Dr. Sarah Cody talking about newly released criteria for lifting indoor mask mandates in the county. They're lining up with the CDC. They're saying that as long as a county stays in the yellow tier of transmission for 3 weeks, at least 3 weeks, they have low hospitalization rates. 80% of the people eligible are fully vaccinated. Though once that criteria is met, indoor mask mandates will be lifted. We are waiting on a press conference with Contra Costa County as well. We should be hearing from them momentarily. But before we go there, we're going to take a quick break. You're watching Crown On. We'll be right back.